Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Sir, I wanted to ask you about vitiligo. It is fairly common, is it
Yes,
not?
yes. Vitiligo is where there is complete depigmentation of skin. And it can come in patches, but definitely it is not a local disorder in skin, though it is apparent or pronounced on skin. It is an internal disorder because this melanin pigmentation is something which is centrally designed and planned. Therefore, the aberration or what we can call imbalance or a confusion occurs at that level and then the depigmentation takes place. So vitiligo is not a local disorder in skin. Therefore, some people have tried, some dermatologists, that they just used to have skin graft. They used to just take skin from a normal area,
Oh, I see.
pigmentation, and used to graft, and definitely it used to make it worse.
Made it worse.
Yes, yes. Not
Ah,
only that same patch grew up, but even other patches started surfacing gallopingly with that. So that also doesn't help. Then people feel that it is like an hyperimmune response. But even that has become now a myth. So
ah.
people used to give steroids as a routine therapy. And then the phenomena of vitiligo used to just get flared up. So we have to understand that vitiligo is something which involves the deeper confusions in the system at the level of central system at hormonal levels. For example, like the person having hypothyroid or thyroid malfunction can be prone for this. Then the where the what we call endocrinal dyscrasia is there from right from pituitary even progesterone estrogen levels,
Ah,
so can definitely influence the pigmentation.
ah.
So these melanocytes actually are responsible for governing this pigmentation, and this melanin pigmentation is governed centrally. And just see, like fever we get in malaria, we get in typhoid, we get in pneumonia. So fever is just a symptom of the disease, it is not disease.
Right.
Similarly, depigmentation, similarly the vitiligo can be because of so many reasons attributing to it. So vitiligo in one person will have different genesis than vitiligo in the other person.
Okay.
So we have to work out that and then treat the disease, then only it is amenable. Homeopathy
It
has,
is amenable.
yes, homeopathy has remedies.
Will it reverse?
It has reversed. In many cases, it has
Ah,
reversed. We can check the progress, we can retard the progress, and in some cases, it has reversed and it has never come back. Yes. So it has reversed completely, especially in younger age. It reverses, and if it is minimal. See what happens. Vitiligo is not something which is a crisis for body doesn't find it because the vital
no.
functions are not
Yeah,
hampered.
yes, yes.
So cosmetically or for social reasons people get worried about vitiligo,
Because
but
they
body,
consider it unsightly.
yes, but body itself will not consider it as a crisis. And homeopathy has one limitation also. Like what we can do is we can take the totality and give the remedy to the person which is fitting into the present totality, which covers that.
Yes.
And vitiligo can be one of the component of totality. But when we give homeopathic remedies, it is the own vitality, it is the own healing force which will go in action and start correcting the system so that the vitiligo reverses. But if the system has some other crisis in the body, that system will not pay more attention to reversal of
Ah,
depigmentation. So it takes pretty long time. But we have seen some cases where everything is all right and no other crisis body has attended it within few months. Within the course of 3-4 months, the whole depigmentation has reversed and it has come to normal. So what we do is we counsel the patient in the beginning that we are not treating vitiligo directly. We are treating you who has compromised by developing vitiligo, and then it would reverse. And this is a general disorder. In some cases, we can check, we have checked the complete progress of the disease. It has not progressed, but it has not even reversed. I, I remember a case where the girl at the age of 8 years, she was brought to me and she had 1 inch patch on ankle. And that we started treating on the basis of totality. It did not grow. At the same time, it did not reverse. There was absolutely no pigmentation on that area. We treated her till she developed, like she adolescence, then regular menstruation, then she got graduated and married. And then also every 3 years I used to tell them somehow there is no further response. And she doesn't have any other complaint. So it's completely one-sided complaint in her. So we can just stop treating. Anyway, it is not growing. So maybe at that level, body has responded. That body has checked the phenomena of
And there's
depigmentation.
been no further increase.
But they would say, no, we would like to continue for a while. And then after 12 years, then we realize it is same. And then they told now she has delivered a baby. And till date she has not developed, means whole life she won't go get it. And then we stopped the treatment. Though the patch was like that. But they were happy because other contemporary cases who had developed vitiligo like her, and they were just inquiring about them, and they were completely worse, like other cases, not with us, but who had gone to like conventional treatment with they give steroids and sun therapy and all that,
and nothing helps.
And nothing helped. It went on progressing gallopingly. At the same time, I remember one case, like young boy, and routinely we counsel that it may reverse or it may not reverse. It may respond or it may not respond. So one clerk, he was working as a stenographer in court. He said, no, some person is giving me medicine and he has promised that in 6 months it would respond. And I said, fine, you go ahead with it, and if it doesn't respond, then you come. And after 6 months, he developed acute renal failure, and he was admitted in hospital under nephrologist. And they found that it was steroid which has caused kidney damage. And then it took few months to reverse, and by then he was completely white, depigmented, complete leukoderma.
The whole body.
Almost like 80% of the body was depigmented and worse, and within 1 year. Hardly he had 6 months treatment. So comparatively, homeopathy doesn't have side effects. Then it's easier to give remedies. They are not at all expensive, and definitely cure percentage is far better than any other system.